recording going. Here we go. All right. Thank you for attending today's webinar. Today's webinar is over revenue, quick tips, and added value to your billing without increased workload. My name is Crescent Beavers. I am the Senior Risk Adjustment Manager here at Premier, and I'll be your presenter today. So tips and tricks for your front office. Confirming appointments and verifying eligibility, collecting your copays and coinsurance and deductibles up front, standby lists for last-minute cancellations or no-shows. Follow-up visits are scheduled before the patient leaves the office, and excellent patient scheduling processes. This helps significantly reduce the times for your patients on having a strategic process in place of maybe seeing face-to-face visits in the morning and telehealth in the afternoon. All of these can be things that can help in your office in the workflow and managing that those patients and getting those copays and deductibles and verifying everything up front will help increase the revenue into your practice by ensuring that all of those things are in place before the patients come into the office. Or if you have those last minute cancellations, you can fill those spaces and not have lost revenue. On the billing side, for tips, submitting your claims timely and knowing all of your timely filing for all your payers, correct payer ID for your claims, ensuring that you are submitting that claim to the correct payer the first time that claim goes out the door, addressing denials and rejections timely. Outstanding AR is lost revenue in your practice. So making sure that all those claims are worked on a timely basis is crucial. Insurance payments posted to your accounts timely. Unapplied monies is hidden opportunity for lost revenue. If you just have money sitting out there that is not applied to the accounts, those accounts could be aging and you're not aware of those denials or partial payments that come in through the door. So that's a crucial thing to monitor also in your billing practices. And ensuring all chronic conditions are being applied to your claim to increase your RAF scores. And also your telehealth visits are billed correctly with the correct place of service and modifiers that need to be applied to those claims to ensure full payment of those claims. So tips for our providers, signing off on your clinical notes. Medicare requires that the notes are signed and closed within 30 days of the visit. This is a requirement from CMS. If this is not done properly, they can essentially come back and recoup their money if they do audits or have other penalties and ramifications if these are not done. Chronic conditions are documented and billed if they are considered during a medical decision-making process for acute visits. So this is something that we see across all of our providers, is that if you are prescribing a medication for a patient that comes in for a cough or an acute visit, and you have to take in consideration that patient is a diabetic to determine what medication to put them on, that's part of your medical decision-making. And that needs to be billed and documented on your claim. Accurate documentation. If it's not documented, it did not happen. So if the patient comes into the office and you address, certain conditions with the patient and you did not document those conditions, they didn't happen, and therefore we're missing out on those opportunities. Or even if you gave a breathing treatment to a patient, making sure that those are documented and billed are crucial. Convert your visit to an AWV or an annual wellness visit if the patient is due. This may be the only opportunity that you have all year to see that patient is when they come in for that sick visit. And if you know that they're due for their annual wellness visit and it's not a Medicare patient, going ahead and doing that and converting those over to where you have a comprehensive visit with that patient could close all your quality gaps, your HCC gaps, and increase your revenue. Ancillary services. So we see in a lot of practices that practices do lots of different things and they don't know that they can bill for them. So this is not a comprehensive list of ancillary services that can be done in your office, but these are the common things that we see that our offices provide these services and they don't bill for them. These are all billable services that can be increase the revenue into your practices. So if you're doing any of these services on this list, you really need to take in consideration on billing those services out to increase that revenue within the practice. And how does risk adjustment help support you, and how does Premier support you in your risk adjustment efforts? What we can provide for you is that we can take in those charts of those patients that you see within a 48-hour period, and we can audit those charts and notify you of anything that we see that could potentially increase your revenue, or if there were conditions that were not addressed at the time of service, we can provide that feedback to you. We can do in-depth chart reviews, including retroactive, concurrent, and prospective chart reviews for you to see if there are any other opportunities of risk adjustment or quality gaps that we can close for you. We ensure that all chronic conditions are captured every year. So when we're doing those chart audits, we're looking for all of those conditions that not only may have been addressed in your office, but may have been addressed by specialists or in the hospital, or conditions that come up that really need to be addressed every single year. We track those risk scores, or your RAF score, and your HCC recapture rate, so that you know how you're doing throughout the year and how you're trending, and making sure that all of those scores are captured for you. And providing that feedback back to the providers and doing education for those providers to accurately document all of those conditions. We do have monthly educational webinars that are set up. Every other month we do a live education webinar, and on that opposite month we do a pre-recorded education webinar. These could be on all different ranges of subjects, from diagnosis conditions to industry updates of what's going on, billing and coding tips, things related to CMS guidelines that are coming down that we need to notify our practices on, all different subjects. And that schedule is something that we put out on a yearly basis so that we know what is coming up every month. And we provide coding and billing tip sheets as well. So we have, tip sheets on all kinds of different conditions, how to properly document those conditions, how to bill out certain procedures, and much, much more that the Premier Risk Adjustment team can provide for you. So those are just some brief tips and tricks that Premier can add for you, and that you may want to take into consideration for your practices and being a part of the Premier ACO that you know. And I will give a moment to Michelle Stordo, our COO, if she would like to make any comments.
Well, thank you, Constance. Thanks for taking this time with us today. As always, we love learning from you and all the knowledge you and your team have to share with us. Obviously, Premier is interested in helping our providers as much as we can and in growing with the provider community. So if you'll reach out back to us, we can connect you with other resources like this, expanded educational opportunities, and even be more hands-on specific to your practice depending on your needs. So we're here to help. We're the ACO that you know, and we have to date helped providers earn over $37 million in shared savings just through our ACO program alone. So if you're here to consider that opportunity, we appreciate your time and we hope to talk to you more about that. Thanks again, Crescent, for a great discussion.
Thank you, and I hope everyone has a great afternoon, and thank you for attending.